Hi, this is Dr. Mark Taylor. I'm the founder and medical director of the Gateway Aesthetic Institute Laser Center in Salt Lake City, the largest dedicated cosmetic laser center in the world. Today I would like to talk about liposuction and non-invasive body shaping and also help you understand the details. GLP-1s are shots that are called fat shots, colloquial, and they can reduce the overall body fat but not do a good job of shaping the body. Less fat will make it easier for body shaping procedures such as liposuction. However, these shots may also cause uneven fat loss such as hollow cheeks and butt, still useful to help reduce obesity. The invasive options for body shaping include Tumescent Liposuction, VASER, SmartLipo, and BodyJet. Tumescent liposuction is not a weight loss procedure. This artfully shapes all body areas such as the abdomen, waist, love handles, arms, inner and outer thighs, double chin, bra fat, buttocks, pubis, breasts, calves, ankles by selective fat removal, and there may be other areas that can be treated as well. Here's some before and after photos of Tumescent liposuction. On the left, we see some areas that are circled prior to treatment to stay focused on the areas of excess localized fat before and a nice after below. And then a classic area, tummy and love handles with a very nice result after. How is Tumescent liposuction performed? It's comfortable with mild conscious sedation, which is safer, or general anesthesia. Tumescent anesthesia is dilute lidocaine, also contains epinephrine and sodium bicarbonate and sometimes a steroid to reduce inflammation. This makes the procedure nearly painless. Fat is suctioned out of local body areas with a small tube to achieve the desired shape. Post-operative pressure clothing are worn for about 1 month, and care is protected to reduce any risk of infection in the little areas where the fat is sucked out. So what's VASER? Well, VASER is an ultrasonic probe that is used to loosen and emulsify the fat prior to removing it with suction. VASER is helpful to remove fibrous fat, especially in men's abdomen and breasts, and in women also in fibrous areas, and also for high definition body etching and sculpting. VASER is an add-on to Tumescent liposuction. Here we have on the left a man with high definition body sculpting, and on the right a woman with a typical tummy pooch that is removed, showing her results the next day after the dressings are removed. This is permanent fat removal, and if a patient maintains their stable weight, this fat is gone forever. How about BodyJet? BodyJet uses a high-pressure fan-like spray nozzle to loosen fat and then suck it out through a 2-lumen tube. One tube sends the spray in, and the other tube sucks the fat out. This is less traumatic than regular liposuction and ideal for removing smaller areas of localized fat. This is excellent when the fat is to be used for fat transplant to the breast, buttock, face, or other body areas, because essentially the fat is getting washed during the process of being sprayed and then sucked back out. Here are some examples of BodyJet before and after photos. On the left, you can see the areas that were marked, and below the nice results. Also on the right here, we have, again, typical tummy pooch with love handles and a nice result afterward. How about SmartLipo laser? A laser cannula is used to melt fat and tighten the overlying skin prior to or immediately following Tumescent liposuction, where the fat is sucked out. This works well on smaller areas like the neck, arms, thighs, etc., and is excellent for leftover tummy pooches with overlying loose skin. This may also be used on the double chin on the neck, on the arms, on saggy skin above the knees, and is an excellent way to both remove excess fat and help to tighten the skin overlying those areas. Here we have some nice photos before and after SmartLipo. Notice the excellent improvement in the inner and outer thighs on the woman on the left, and also on the right, notice the nice tightening of the skin on the lower abdomen and around the belly button. Here we combine both BodyJet and SmartLipo with a very nice result, again, on the tummy and love handles and on the hips and flanks. So let's talk about the benefits. Tumescent Liposuction, together with the add-on alternatives, VASER, SmartLipo, and BodyJet, has the highest level of satisfaction with patients compared to other types of body shaping procedures. Much better than non-invasive procedures such as cool sculpting, radiofrequency, infrared laser such as sculpture, and electromagnetic muscle stimulation with or without radiofrequency. What are the risks and complications? Tumescent anesthesia is used with all forms of invasive body sculpting. Care must be taken to avoid excessive lidocaine toxicity. It's very safe in experienced hands. There's a small risk of infection, bleeding, or embolism with any form of liposuction. VASER has a very small risk of skin burns when performed by experienced surgeons. Bruising, swelling, and postoperative discomfort may occur with any of the procedures involving tumescent liposuction type procedures. This is usually not a big problem. Liposuction performed under general anesthesia has a much higher risk of complications than tumescent liposuction performed with conscious sedation. How about the non-invasive body shaping? Cryolipolysis, also a brand name called cool sculpting, laser lipolysis, such as sculpture, radiofrequency, and EMS, example is mSculpt Neo, ultrasound, such as liposonics or ultrashape. These devices have limited efficacy in true body shaping and are best used to treat small areas where the patient will be satisfied with 20 to 30% improvement. These devices are extremely popular in poorly trained medical spas that lack the expertise or training to do tumescent liposuction. Let's talk about cool sculpting. It's a popular procedure for treating small areas of localized fat, such as tummy pooches, arms, double chin, thighs, and love handles. Fat is sucked up into an applicator and frozen. As the fat thaws, some decrease in fat volume is usually achieved over a 3-month period of time. Multiple sessions and applicators are needed for patients with multiple areas of localized fat. Ideal when the small area of localized fat fits perfectly into this cool sculpting applicator. And there are multiple different applicators of different sizes that fit, like the double chin, the tummy, the love handles, the arms, etc. It's not a good option for overweight patients or patients with larger areas of localized fat. This rarely causes paradoxical thickening or hardening of the fat, which can be a difficult problem to solve. Here's an example of cool sculpting with modest improvement in the tummy and love handles. How about radiofrequency devices? Most of the radiofrequency devices are approved 510K devices that are approved by the FDA as predicate devices, similar to other devices that have already been approved by the FDA without doing their own clinical FDA monitored studies. Radiofrequency energy is applied externally to the skin and fat. Fat is heated to a critical temperature and may be damaged enough to cause a decrease in volume. Some modest improvement may be seen in localized body shaping. I personally am underwhelmed with most of these radiofrequency devices. Multiple treatments are required for any significant success. RF may produce, I should say, some skin tightening as well as fat reduction. Laser lipolysis. Infrared laser light radiation through the skin into the fat damages the fat cells with modest reduction in fat volume. Ideally, this may achieve up to 20% or more reduction in localized fat volume. Multiple sessions and applicators are usually necessary to achieve significant improvement. This is an example of laser lipolysis and skin tightening, also some improvement in stretch marks on the abdomen. This is an example of laser lipolysis with sculpture from Dr. Setti in McKinney, Texas, showing modest improvement in the overall bulk of fat on the abdomen. Radiofrequency plus EMS. This is a device called the Emsculpt Neo. This uses radiofrequency to heat and damage fat cells, while EMS, the electromagnetic muscle stimulation, stimulates muscles to build muscle volume. In combination, 20 to 30% reduction of localized fat volume and increased muscle volume may be achieved. Multiple sessions are necessary. Radiofrequency energy may produce some skin tightening as well. This is an example of a self-posted photo of Emsculpt Neo. This is not one of my patients, but I think you can see slight improvement in the lower abdomen following treatment. How about Kybella? This is deoxycholic acid injections, and Kybella was originally approved for treating localized fat in the double chin area. Multiple treatments are always required, and swelling and discomfort occurred following the treatment of these areas with injections. The injected fat takes weeks to months to heal and to shrink. This is not a good option for larger areas of fat. How about focused ultrasound? Focused ultrasounds such as Ultrashape or Ulthera Body creates heat or acoustical damage to fat cells. Multiple treatments are required to achieve even modest improvement to localized areas of fat. This may provide some tightening as an added benefit. So, what are the benefits of non-invasive body shaping? Well, it's non-surgical with easy recovery in most cases. There's mild to modest improvement with no lifestyle interruption. Patients with low expectations may be happy with these non-invasive body treatments. They do not require much technical skill, so very popular in poorly trained and poorly supervised medical spas. What are some of the adverse effects and risks and complications? Many of these devices are painful during treatment. No pain, no gain. Lack of expected benefit is common. RF devices may cause skin burns and scars. Cool sculpting may occasionally cause paradoxical fat hypertrophy or uneven depressions, which can be difficult to treat. Kybella can occasionally cause nerve damage. The options expressed in this presentation are my own based on over 40 years experience using most of these devices in this presentation and doing thousands of cases of liposuction. I am also familiar with the peer-reviewed research literature that has been published by the manufacturers of these devices. So what is my conclusion here? If you want safe and highly successful body shaping for significant localized fat deposits, do some form of Tumescent Liposuction with a highly experienced and respected cosmetic surgeon. preferably with conscious sedation rather than general anesthesia. If you would be happy with only 20+% improvement in your body shaping journey, consider the non-invasive body sculpting options with a highly experienced and respected medical office. Avoid treatments at poorly trained and poorly supervised medical spas without an experienced medical doctor on site most of the time. Thank you so much for listening and watching. If you have any questions, you can email those to info@gatewaylasercenter.com or call and set up a video consultation at 801-595-1600. Thank you so much for watching.